The cages are empty at poultry markets in New York this weekend by order of state authorities over concerns about bird flu.
Over the last week, inspectors have detected 7 cases of bird flu in poultry during routine inspections at live bird markets in the Bronx, Brooklyn, and Queens.
Since this outbreak first began in 2022, the H5N1 virus has wiped out more than 156 million chickens, turkeys, and other birds across the U.S. It's also infected cattle, nearly 1,000 herds in 16 states, and 67 people, resulting in 1 death last month. In Canada, a 13-year-old in BC was hospitalized for months after contracting bird flu. She was discharged last month, and as this infectious disease specialist tells us, the threat to humans remains low.
As of February 7th, 2025, the risk to the general public is low, but of course we know that this is a virus that has epidemic and pandemic potential.
Since last month, hospitals in the U.S. have been advised to proactively test specimens collected from people with common flu symptoms for bird flu. In Canada, the risk level is evaluated in a few different ways.
If someone has symptoms consistent with this and is in close proximity or has a history of being in close proximity to animals, the sample could be sent for H5N1 or other avian influenza.
Provincial health labs also regularly test a subset of flu samples to check which subtype is circulating. And as part of a nationwide program launched last year, the Canadian Food Inspection Agency also tests retail milk samples for avian flu.
It's a food security issue as well. It's not just a human health issue or an animal health issue, it's a food security issue. That's why it's being taken so important.
Nivrita Ganguly, Global News, Toronto.